My name is Dr. Leanne Nieforth. I'm a postdoctoral research associate at the University of Arizona College of Vet Med. I specifically work in the O'Hare Lab, or the Organization for Human-Animal Interaction Research and Education. And today I am thrilled to be here to chat about animal-assisted interventions for autism spectrum disorder. So we have a three-pronged agenda today. The first is to go over why animals. Why have we even considered partnering with animals as an intervention option? The second is, what is an animal-assisted intervention? There are many different types and many different interpretations of what this looks like, so we'll kind of dive into that. And then lastly, we will mainly be focused on what the research says thus far, specifically about animal-assisted interventions for autism spectrum disorder. So to start, why animals? Well, we are inherently attracted to animals, and this stems from something called the biophilia hypothesis. And what this means is that over time, as we've evolved over the hundreds of thousands of years, we have been in situations of nature. So we've been outside, we've been interacting with animals, we've had natural light, we've had plants all around us, and now we find ourselves often in office buildings or in buildings with no windows, no plants, and no animals. But we still have this innate drive and feeling and attraction towards living things. And one of these living things, obviously, is animals. So we are predisposed to benefit from adding little snippets of this nature back into our lives. So as we kind of think about this innate, inherent attraction we have to nature, to animals, to light, to plants, we're going to go through some different pieces of kind of how we've started to incorporate these things into our daily life, some people more than others. So to start, we will think about this kind of silly trivia question, but it's important. So which number is the highest? The number of people that go to US zoos and aquariums, the number of people that go to NFL and NBA games, the number of people that go to NHL and NFL games, or the number of people that go to NFL, NHL, NBA, and MLB games combined. So unfortunately, I cannot see responses, but I hope everyone has kind of selected one. And the answer to this actually is the number of people that go to US zoos and aquarium is the highest. So that number is larger than all major US sporting events combined. So you can see here that we are actively seeking out, more so than we think sometimes, seeing animals. This is just one example. So not only are we seeking out animals, in this case in a sporting, or more than a sporting contest, but animals are also infiltrating our sporting events. For example, in a few weeks, it's the Super Bowl. Now, some people watch the Super Bowl because it's the Super Bowl. Other people watch it because they want to see the Puppy Bowl and the Kitty halftime show. Additionally, we see animals infiltrating other sports, such as goats in goat yoga. So, you can do goat, yoga on a farm, in a horse pasture, oftentimes having baby goats literally jump all around you. So here we see, again, we are inherently attracted to animals. We're seeking them out in zoos. We're inviting them into our sporting events and into our daily sporting practice. But additionally, we are seeking them out in other ways as well. And this is an interesting example. So this is a photo of something called the Cat Video Fest. So this is a festival that happens around the world. They go on tour where thousands of people travel pretty far distances to come together and watch videos of cats online. So though there's not an animal specifically present there, people are again drawn to watching animals, whether that be in a one-on-one in-person setting or with thousands of other people watching cat videos online. So not only, again, are we seeking animals for our sporting events, but also our daily yoga and, what we're watching, but we also invite these animals into our home. So currently, 70% of the US population has animals in their homes. That's about 90.5 million homes. And it was up from 56% in 1988. So this is continuing to grow over time. And with that, we are spending a lot of money on our pets. And why do we think that is? Or, how much is that? So again, here's a fun trivia question. Are we spending $99.2 billion, $123.6 billion, $1 trillion, or $90.3 million? And believe it or not, we are spending $123.6 billion on the pets in our home. And that doesn't include all the other ways that we interact with animals in our daily lives. So why are we doing this? So we're seeing a lot of people put in a lot of resources here into something that seemingly doesn't give much in return. So these sorts of questions are really what frame our research and the field of study on human-animal interactions and relationships. So there's a few different hypotheses as to kind of why we're seeking out these interactions. The first is that animals may impact our health outcomes. So right now I'm going to talk broadly about human-animal interaction research and how animals may increase or decrease certain things in our lives. And then in a little bit, I'll dive deeper into the animal-assisted intervention literature for autism spectrum disorder. So one of my favorite studies that illustrates the fact that animals may impact our health outcomes actually was published in the 80s. And this study looked at a sample of individuals who had just had a heart attack. They were released from the coronary care unit to the intensive care unit in a hospital. And then 1 year later, if they had owned a companion animal, they were more likely to be alive than if they did not have a pet. Pet owners had 1/3 the mortality rate of non-owners. And this was after controlling for physiological measures, such as the severity of the cardiovascular disease and other important demographics. So we can see here that there's something about having a pet that is linked to health in this instance. And it's important that as I share these different outcomes from different manuscripts, that right now the human-animal interaction literature is quite young. So some of these initial articles were put out in the 80s. And with that, there have been other articles since that don't have the same findings. But it is important that as researchers, we look for both the positive things as well as the null or negative findings to ensure that we're not cherry picking our results to really develop a holistic understanding of the interventions and what's happening. On top of that, it's important to recognize that individuals are individuals, right? So what affects one person might not affect another. So just something to keep in mind kind of as I move through and as you hear different findings regarding human-animal interaction. So not only may animals potentially influence our health, but they also can make us feel better. They can improve our mood. We can perceive less pain when we interact with them. They can lower our blood pressure, and they can have a significant influence on our stress hormones. Animals can also make us look better. So this research group created fake Tinder and Bumble online dating profiles to empirically measure what the effect of having a dog in your profile picture was. And they found that there were 45% more matches for individuals that had an animal in their profile picture, 75% more messages, and 53% more interactions overall. So not only are they helping our physical health potentially, but our mental health, they're making us look better, and they can potentially give us some social support. So I don't know if anybody in the audience has a dog or a cat, but if you get home from a long day at work and walk in the door, it's pretty common that your dog greets you at the door, tail wagging, so excited to see you because they haven't seen you in absolutely forever, right? So they have seemingly have a positive expectation towards us, but we also have positive associations towards them. They serve as a source of social support, perhaps sometimes more effectively than our spouses or close friends. And researchers have studied this by placing individuals under a stressful task randomly in several conditions. So they did this alone, with a close friend, or with their pet. And this stressful situation was doing subtraction backwards. So they had to stand up in front of a room and start subtracting from 2023 by 17 backwards. The first time they did it by themselves. The second time they did it with a close friend or spouse. And then the third time they did it with their pet. And what they found that was when the pet was present, the individual had significantly lower blood pressure, and heart rate, significantly lower stress hormone reactivity, and even made less errors than in other conditions. So again, to reiterate, what are we seeing here? We're seeing animals have a potential influence on our physical health, our mental health, our social interactions, social support, making us look better. And because of all of these potential avenues for human health and well-being, we're beginning to include animals in a variety of therapeutic settings. As you can see on this slide, we have multiple species of animals, but we have a service dog in the top left, we have a therapy cat in the middle here, we have a miniature horse towards the right, a larger horse participating in some therapeutic riding on the bottom, a bunny who's a therapy bunny in a hospital, as well as another type of service dog, a diabetic alert dog. So as you can see here, we are partnering with animals and have been for many years to help humans therapeutically. So the next part of the presentation will focus on what is an animal-assisted interventions. We have these ideas that animals can help us in all these different ways, and we've started to incorporate them into interventions. But as I showed you on the last slide, there's many different options, many of them not even pictured, as well as many different animals that can be involved. So an animal-assisted intervention is a broad term used to describe the utilization of various species of animals in diverse manners beneficial to humans. Specifically, it's an intervention that intentionally includes an animal as part of the therapeutic process. So if an animal is part of the therapeutic process, it is considered an animal-assisted intervention. Now, there are multiple types of animal-assisted interventions. The first we'll talk about is animal-assisted activities. So these provide opportunities for motivation, education, or recreation to enhance someone's quality of life. And common animal-assisted activities include therapy animals that visit hospitals with their handlers, therapy animals that visit nursing homes with their animals, and then college exam de-stress events. So it's becoming more and more common across campuses across the US to partner with local rescues or animal shelters to bring puppies and kittens to campus during finals week to provide a pet the puppy de-stress experience for college students. And then lastly, another more common animal-assisted activity is a crisis response team. So when a crisis happens, oftentimes therapy animals will report to the scene after the first responders. And with these activities, it's important to recognize that these animals are paired with a handler that brings them to the activity. So their handler is not necessarily benefiting from the services they're providing. The therapy animal is partnered with the handler to provide an activity that has some sort of motivation, education, or recreational purpose for quality of life. Another type of animal-assisted intervention is animal-assisted therapy. So this is goal-directed and documented as part of a treatment process. So unlike animal-assisted activities where animals have some sort of therapeutic value to the participants, animal-assisted therapy partners with human therapists. So there are multiple types of therapists, obviously, and with that, there are multiple types of animal-assisted therapy. So I'll give a few examples here. The first is animal-assisted psychotherapy. So this is therapy with a psychotherapist that includes an animal, most commonly dogs and horses. However, other animals are also incorporated, such as goats or pigs. Second, animal-assisted social work. So this is very similar to animal-assisted psychotherapy, but instead of a psychotherapist, you're working with a social worker. Next, we have animal-assisted physical therapy. So this is physical therapists working with animals. This is common in the equine-assisted world, so doing therapeutic horseback riding, for example. And then lastly, animal-assisted speech therapy. So working with a speech therapist or speech pathologist and an animal in a therapeutic setting. And then lastly, animal-assisted education. So these are planned and structured interventions with specific academic or educational goals. And the most common of these is an animal-assisted reading program. These can happen in many different places, like physical spaces, one of which being at the library. So some therapy dogs will go to libraries to have kids read to them. Other examples include horse farms that run horse reading programs where the kids come, weekly for an hour and sit in front of the stall and read to the horse, or read to the horse in the pasture. So as you can see, given that there's 3 categories of animal-assisted interventions and multiple examples for each, many of which I didn't even mention here, animal-assisted interventions are happening more and more, and they're pretty common. You can ask someone what interventions they've tried, and many times people have tried these things, but science is needed to validate and understand their impact. So we know anecdotally that working with an animal in a therapeutic setting has therapeutic qualities and benefits, right? If you talk to someone about their experiences, we have many, many stories about how an animal has changed the life and improved the well-being of a human being. However, we really need the science to back up those stories. And that's something I'm passionate about. And I'm passionate about really raising and empowering the voices of the stories that we hear to have science validate those experiences. And with that, the best example is, if you go to the doctor and you have a sore throat, the doctor is going to do some tests, right? They might look at your throat, they might swab you, and they're going to get some test results back. And it's going to say, okay, for example, you have strep throat, your swab came back positive. And with that, the doctor is going to look at the literature and say, okay, it looks like, this particular medicine works best for the type of bacteria that's causing your strep throat. I'm going to prescribe you this medication. So that decision that the doctor makes is based on data and literature and studies that have determined that that particular medicine or drug is useful in that situation. So our goal as human-animal interaction researchers, and more specifically those of us that look at animal-assisted interventions, is to provide that same data and information to clinicians and practitioners, as well as parents and caregivers that are making these decisions for their children or the person that they are caring for. So what do we know so far? What does the research say about animal-assisted interventions for autism spectrum disorder? And similarly to other human-animal interaction and animal-assisted interventions, we have many instances within the popular media with books and articles and movies and mainstream stories of individuals whose lives are greatly enhanced from interacting with animals. Now, these are beautiful and wonderful and fantastic stories, and I love to hear about them. But what is the empirical basis for these seemingly magical outcomes? There's so much magic in working with humans and animals, but if we can use science to define that magic, we can make it more accessible, more effective, and easier to understand. So how do we do this? So in our lab, we have been collating systematic reviews of the literature since 2013. So a systematic review is essentially when we look at all of the publications ever published on human-animal or animal-assisted interventions for autism spectrum disorder. So we search high and low for any study, any manuscript that has ever looked at animal-assisted interventions for autism spectrum disorder, and we pull them together into one document. And that document is called the Systematic Literature Review. So my PhD advisor, Dr. Maggie O'Hare, started doing this back in 2013. And at that point, she had pulled everything ever published about animal-assisted interventions in autism spectrum disorder and pulled that into that article. 3 years later, we did a follow-up article where she did it again. And, there was many new articles posted. So it was, again, an opportunity for her to collate all of the recent findings into one paper that was easily digestible and summarize kind of what we knew in that moment. And then in 2021, I followed and did a third, making sure that we had encompassed all of the literature ever published up until 2021. So for the next few slides, I'm going to be talking about the findings of all of these studies in a very summary-oriented way, as not to share 85 different manuscripts with you. So the field is growing. So this graph here shows the number of publications over the years, and each color represents one of the systematic reviews. So the first one looked at 14 studies over a 24-year period. The second looked at 28 studies in a 4-year period. So you can see the exponential growth that's happening here. And then the third study looked at 43 studies in the past 5 years. So as you can see here, this trajectory of growth is moving very quickly, meaning we are really publishing and doing many more studies on human-animal interaction and animal-assisted interventions in general over time. And this is great because, we have more science, but the purpose of the systematic review is to not only collate the science, but determine, what's missing, how can we do this better? What do we need to know that this is an effective intervention or not? So in this, the field is international, and though our systematic reviews were limited to English, there was international representation among researchers. So in North America, there were 44% of the studies we looked at. Europe had 34% of the studies, Asia 10%, Australia 9%, South America 2%, and Africa 1% of the studies. So you can see that people around the globe are focused on animal-assisted interventions for autism spectrum disorder. And this field is also interdisciplinary. There are people and scientists and researchers from so many different disciplines across the world doing this work. And this is a huge asset to the field because of the differing perspectives that are presented in each of these different manuscripts because of the different perspectives within the disciplines. It's also sometimes a problem because sometimes we don't know, like as a psychologist, we don't know what the sociologists are doing or the anthropologists are doing or the physicians are doing, or the historians are doing. And it's really important that we get everything in one place so that we can build upon one another and know about one another rather than continuing in our own silos and not really communicating across disciplines. And human-animal interaction in general is a very interdisciplinary field across the sciences, across the humanities. And it's really fascinating to see all the differences in perspectives and the richness that they add to the literature. So what types of animals are we seeing within the literature? We are seeing most commonly horses, then followed by dogs, then guinea pigs, then dolphins, and then cats. And in the literature of human-animal interaction, though cats are really common household pets, they are not commonly researched in terms of animal-assisted interventions. So it's really exciting to see them beginning to get on the board in the last 5 years. And horses and dogs have continued to kind of flip-flop between the most popular in terms of research articles on animal-assisted intervention for autism since we began doing this work back in 2012. So as we went over earlier, there are many different types of animal-assisted interventions. And I went over 3 major categories, but as you see here, there are many terms that can be used to describe this. And with that, when we're reviewing the literature, it's important that we're keeping track of what is most commonly reported in the literature, because essentially you and I could both be looking at the same thing, but calling it something else. And with that, we could be thinking we're talking about different things, but actually talking about the same thing. And when you're trying to have a productive conversation and build upon each other, it's really important that we have that common terminology. And I put all of these things up because as caregivers and parents, you may come across all of these terms and not know which is the best fit for the person that you are trying to find the correct intervention for. So as you can see here, typically it's called an animal-assisted animal therapy, animal-assisted, and then you substitute animal for whatever species of animal you're working with. So equine being horse, dolphin, dog, canine being dog. And then there's a few things I do want to point out. The first is anthrozoology. So that is the study of human-animal interaction, anthro being human, zoo being animal, ology being the study of. Additionally, you can see on the screen that I've mentioned assistance animals, assistance dogs, and assistance horses. However, those are not included in the overarching animal-assisted intervention systematic review. They are separately categorized in research as service animals. And service dogs versus assistance dogs. Service dog is a US term. Assistance dog is used more commonly internationally. And I include assistance horse because under ADA regulation, you can either have an assistance dog or an assistance miniature horse. They are both able to be assistance animals. And then the other one I always like to point out, especially when I'm teaching a course, is hippotherapy. Unfortunately, or fortunately, hippos are not typically used in animal-assisted interventions. I am unaware of any study or program that uses hippos. Hippos can be not the most friendly to humans, but hippotherapy is a type of horse therapy. It's typically with an occupational or physical therapist where the person rides the horse for physical benefit. It is not using hippos for therapy. So now that we have all these terms, the biggest umbrella term that I've kind of introduced and obviously is in the title of the presentation has been throughout is animal assisted. So many researchers agree that the encompassing umbrella term is animal assisted intervention, and then you can kind of adapt it based upon the type of intervention that we talked about and the animal with which you're using for that intervention. So what do the sessions look like? So this varies greatly across providers and across interventions. However, the most common sessions are horse sessions. As you can see here in that top picture, we have one horse to one participant who's laying on the horse's back to 3 personnel. And in this particular image, the personnel are the leader, so the person leading the horse, and the sidewalkers, the person, there's one person on each side of the horse ensuring that the child is stable. In another species, so in a dog, the most common sessions are one animal to one participant to one personnel. And personnel here can be in the case of dogs, it can be any sort of therapist, it can be an educator, and in the horse piece above, again, you can have the therapists or you can have volunteers in each of these roles, with the main practitioner being kind of outside of each individual student, talking to many students. And within the literature, the most common time and dose was weekly sessions of 30 to 60 minutes. It really had quite a bit of a range dependent upon the species that we were working with, for a total of about 10 hours of contact time. And these things are important to focus on because these are some of the things that we have the ability to change or adjust that might affect the efficacy of the intervention. So, you know, future studies will potentially look at, okay, what if there's 2 people to 1 participant to 1 animal, like 2 personnel to 1 participant to 1 animal, or what if there's 1 personnel to 4 participants to 1 animal? You know, all of these different pieces play together in terms of developing the most effective interventions. And then before we get into outcomes, I'm going to talk about briefly who's in the sessions within the literature. So in the research thus far, it's typically children, average age of 9 to 10 years old, and 80% male. In the last systematic review that was published, we did have the inclusion of a broader age range. So the last systematic review included individuals who were 2 years old to 60 years old, and there were more females included in those studies as well. However, there is a serious lack of diversity among studies of animal-assisted interventions in general, as well as animal-assisted interventions for autism spectrum disorder. So next, we're going to dive into the outcomes of animal-assisted interventions. So what does the literature say about the outcomes that are apparent after someone participates in an animal-assisted intervention? And the most common outcome reported in the studies is social interaction. So before we kind of dive into that piece, I want to make sure everyone's paying attention to the graph here. So we have social interaction, which is the outcome. Then we have that blue bar with the gray on the end. The blue is the number of positive studies that have been published. The gray is the number of studies that are null or have no change, either positive or negative. To date, there is no research on animal-assisted interventions for autism spectrum disorder that suggests that it is harmful. So studies are positive or null. They're not negative at this point in time. So positive findings have been reported by 48 studies across 40 research teams across 19 countries. So you can see here that we are finding broadly positive findings here. However, it's appropriate to assess and reassess the appropriateness of and efficacy of animal-assisted interventions for each individual over time. So though we're seeing positive findings across the board in many situations, aside from those that are null, of course, it's important to recognize that animal-assisted interventions can be highly individualized to the person, but not every person benefits from an animal-assisted intervention. So back to social interaction. So increased social interaction is the most common outcome reported within the literature. We are seeing increases in both frequency and quality of social interactions. We see increased smiling, talking, and looking at human faces, as well as animals, in the presence of an animal. We're seeing increased social responsiveness, as well as increased empathy, improvements to joint attention and social skills overall, as well as general social functioning. The second most research outcome of individuals with autism spectrum disorder in animal-assisted interventions is regarding language and communication. So we see increases to both receptive and expressive language, yet as in many of the outcomes that we'll discuss, some null findings do exist here, which is again indicative that it's not a one-size-fits-all situation. These work for some individuals and do not work for others. Next, we'll talk about some outcomes that were less reported than social interaction and language communication. And these are problem behaviors, positive emotions, and stress. And what the literature says is that we are seeing decreases in problem behaviors. We're seeing increases in positive emotions, such as joy and happiness and love, and then decreases in stress. We're seeing the decreases in stress subjectively, so through things like a survey where the person says, I feel less stressed. And we're also seeing it through physiological measures. So in this case, cortisol. So cortisol is a stress hormone that helps understand on a biological and physiological level what stress levels are looking like. And these changes in problem behaviors, positive emotions, and stress are perhaps due to the increased social interaction and language and communication improvements that I mentioned a little bit earlier. So next we'll talk about a few outcomes that are even less common in the literature, but still, mentioned quite a bit. And those are autism severity, motor skills, caregiver stress, restricted and repetitive behaviors, and quality of life. So what we're seeing are decreases in autism severity. We're seeing increases in motor skills. We're seeing decreased restricted and repetitive behaviors, and we're seeing increases in overall quality of life. Interestingly, and very appropriately, the most recent papers have begun to include the effects on the caregivers as well. So oftentimes when we study an intervention, we study the person who's involved in the intervention and the intervention itself, in this case, the animal. But recently, researchers have begun to appreciate and incorporate the fact that individuals don't exist in a vacuum and they exist within relationships and communities. So including the caregiver and the parents and the broader family system and broader community system, we're able to see kind of the ripple effects of the intervention, if there are any, or any challenges that may arise for someone in that position when the other person is participating within the intervention. And for caregiver stress, we see mixed findings. So there, as you can see here, there's, about half positive and half null. And with that, we are seeing some reports of increased caregiver burden and increased stress. And then we're seeing some places where stress is decreased and caregiver burden is decreased. So in this department, we really can't say what we're seeing because there's mixed findings thus far. And then another important note here is the restrictive and repetitive behaviors. There's actually more studies that suggest that there are null findings here than there are positive findings for that particular outcome in this intervention. And then quality of life, only about 2 studies have reported on overall quality of life, and both those studies had positive findings. So that is the summary of the 80 plus articles that have been published thus far. And what we see overall is some, obviously some positive things, some null things. We know that, there haven't been any negative findings thus far, but the current evidence is limited by methodological flaws. So though the number of articles is increasing rapidly over time, there is a lack of rigor in methodology. And with that, we see room for improvement. For example, there's a lack of randomized clinical trials. And randomized clinical trials are really important in understanding kind of what we're truly seeing in outcomes, because they can be controlled in many different ways. Many studies in these systematic reviews and that have been published regarding animal-assisted interventions for autism do not have a control group. So we are only looking at individuals who are partaking in the intervention, and sometimes it's hard to differentiate, the effects of the intervention versus the effects of something else that individual is experiencing. And we also have very small sample sizes in many of these studies, and overall just a lack of diversity in the sample themselves. And with that, we need to make sure that the decisions we're making regarding animal-assisted interventions for individuals with autism, that the needs of the person that we're working with should be at the forefront of the decision. So we need to make sure that the client is involved, the family is involved, and the larger care team is involved to determine the best course of action for everyone involved. Additionally, we often get the question, is animal-assisted interventions appropriate for my particular situation? And we encourage, again, everyone to have a conversation about this, the person's family, the person's larger care team, as well as, think about, are there any contraindications? So, for example, is the person allergic to hay? So they wouldn't be able to do a horse-assisted intervention, or are they afraid of dogs and therefore the dog intervention might not be helpful? Additionally, thinking about goals. What's the goal for participating in the animal-assisted intervention, and which animal-assisted intervention, could be best placed to facilitate that goal? And then lastly, and perhaps most importantly and most practically, is what quality programs are available in your area. So there are a few different governing bodies for animal-assisted interventions, yet there's not one that truly governs everyone. And with that, these different organizations have different standards, and these standards lead to different certifications, both of individuals and of programs. So it's important to recognize what standards your local programs are abiding by, which bodies they're certified by, and what they do on a day-to-day basis. And thinking about, could the goals that we want to meet by participating in an animal-assisted intervention be met by this local organization or not? And it truly, there's such a wide variety of animal-assisted interventions, of programs, of different trainings and certifications, that it's really a discussion based on the individual in that present moment. So, in conclusion, animal-assisted interventions for autism spectrum disorder are possibly effective, but future exploration is needed, and caution should be exercised in selecting animal-assisted interventions as a complementary intervention. And With this, I want to point out the word complementary as well. So animal-assisted interventions are not standalone treatment options. They should be used in conjunction with other more traditional evidence-based options. And most of the literature to date suggests that they are potentially an effective intervention, but again, more exploration and more research is needed to really determine what's the best, what works, what doesn't, what can we change to make it more effective, and which particular intervention is most effective for the particular individual. So thank you so much for having me today. I am happy to answer any questions. My email is there as well as our website. We're also on Facebook and Twitter if you're interested in following some of the work that we do.
Thank you so much, Dr. Nieforth. This is a really great overview of, what research is out there. And we definitely had some questions come in. And for those attending, please feel free to keep submitting your questions as we start the Q&A. We'll get to as many as we can get through. Perfect. So starting off early in the presentation, when you were going through the different types of therapies, you mentioned animal-assisted speech therapy. Did any of the research look at how something like that could be integrated, whether that's in a school setting, or is that strictly, in more of a therapy setting, like office setting or something?
Yeah. So to my knowledge, few studies mentioned that, number one, and the study that did mention it, I believe, did it in like a therapeutic setting rather than in a school setting. But that is fascinating and would be a great a great intervention option, especially if there's already a facility dog or a therapy dog at the school. That could definitely be done, and I think there's organizations that train for that.
And then in terms of accessing these therapies, I think this question that just came in from a few people, so I want to make sure we get to it. Are there, how could somebody go about finding these options in their areas? Is this something that is typically covered by insurance? Are there any sort of limitations to access that you've come across?
Yes. So there are significant limitations to access, and that's something that as researchers providing data, we want to talk to the insurance companies and show them that data does exist. So most insurance companies do not cover certain types of animal-assisted interventions. Now, there are exceptions, especially for those programs that are incorporating the therapeutic options with human therapists. So some of those interventions are covered through certain insurances. I'm not an expert on insurance, so definitely make that phone call before you go. But with that, in your area, the most commonly researched animal is a horse. And this is not surprising because therapeutic horseback riding has been around for a long time. There's a large organization, many organizations, but there's one large one called PATH International. It's the Professional Association of Therapeutic Horsemanship. And they have standards, they have certifications, and they certify centers that provide these services across the US. And with that, those organizations have to abide by standards. So if you have a PATH center in your area, that would be where you could start. In terms of canine assisted interventions, so working with dogs, these are often handlers that go through certification with their dogs. And there's another organization called Pet Partners that certifies these therapy dogs. There's many other organizations as well. I just can't think of them off the top of my head. Therapy Dog Alliance is one, but there are some bigger organizations that I would encourage you to look at, the larger organizations that have standards and certifications for their practitioners. That way you know that the people that you're working with have gone through extensive training to do what they're doing.
And then in terms, so you were talking a little bit towards the end of the webinar about some limitations in terms of, even having the option for animal-assisted therapy, like a hay allergy or a fear of dogs, for instance. Did any of the research discuss how to approach animal-assisted interventions if there's perhaps a sensory issue surrounding animal fur, something like that, that could be considered a limitation. Are there ways that these therapies can be like modified or adapted for sensory issues?
Yes, and from a practitioner standpoint, yes, they can be adapted. Now, has the research looked at how those adaptations should be processed, or is there a step-by-step guide to help people in that? No. So with that, that's where practice is ahead of research, in that many organizations are comfortable working through situations, even situations of fear, if the motivation is there and if the interest is there. But research, to my knowledge, has not specifically looked at that particular question.
And then going back to the stress situation that you presented with the mental subtraction, was when that test was run, was the order of the test varied, or did the animal always, was that always the third test, or what did that look like in practice?
Yep, so it was varied, so that you could control for the order, so that was not affecting the outcomes that were reported.
Right.
Good question.
And then has any of the research indicated that there are age, I don't want to say age limits, but ages that this was seen to be most effective, whether it's horse therapy or dog therapy, or if there was an indication if there was a timeline of that was maybe too soon or too late to introduce something like this?
Yeah, so that's an outstanding question that the researchers want to answer, but have no data on so far. So most of the work has been done in children, ages probably 4 to 10 is probably the most common, the average being 9. But in the last 5 years, new studies have come out looking or including individuals who are younger, so as young as 2 and as old as 60. But unfortunately, we don't have yet the knowledge to understand at which age and, what repetition or kind of what group is most benefited or not benefited by animal-assisted interventions.
And then this is an interesting question I thought that came in. So in terms of, I guess, whether it's dogs or horses, particularly asking about dogs here, what does it take really for these animals to become therapy animals? Can any dog do it, or can any horse do it?
Yeah, so again, that is a hot topic question in the research world that we are really digging deep into. And the research answer is, I don't know. And with that, there are obviously, with the certification processes, there are tests and certification and standards that dogs and horses have to meet in order to participate in kind of the bigger programs. But more broadly in human animal interaction literature, being in the room with a fish tank can affect your mental health. Being in the room with an animal can also do that. So sometimes it's just simply the presence of the animal, and the human facilitator plays a bigger role. But again, these are all hypotheses, and we don't know yet. But we're looking in our lab. We're actually looking at it's a little bit different, but with service animals and looking at what breeds and what behavior characteristics make the best service animals. So there are studies that are ongoing about that, and hopefully in the next 5 to 10 years, we'll be able to answer that question.
And you indicated that the animal-assisted intervention shouldn't be, the sole type of therapy, especially in autism. How would is there any research that's looked at introducing the animal-assisted therapy versus just strictly having a service animal? And if there's ways that those can sort of work together?
Yeah, so to my knowledge, the literature in autism service dogs is quite limited. Our lab is actually about to publish papers this year on our study with service dogs and autism spectrum disorder, but that field of literature is quite small, and I don't believe there has been a controlled study comparing service dogs versus other types of animal-assisted interventions. So that's fascinating and could be really interesting to think about, especially in the canine therapy realm, or, if you pair kind of horse therapy with a service dog, is that more effective, less effective? But that goes into the future research of really understanding kind of the mediators and the moderators and the mechanisms behind how these things work, so that we can truly combine them to create a really individualized intervention that can be person specific. And with that, I think there's a lot of room for growth, and a lot of questions that haven't been answered yet, but good question.
And then was there any indication if there's ways to investigate potential outcomes prior to fully investing in therapy? Like how would you recommend somebody goes about something like that?
That's a really interesting question, and I don't think there's anything in the literature that has looked at that. So the dosages that I mentioned, so the weekly 30 to 60 minute for about 12 sessions, that's the average that we're seeing reported in the literature, but that varies quite a bit. So that would be a discussion to have with the provider and with the family to understand kind of what are they willing to do, what's typical for their program, what's typical for their child, and really having an individualized plan that is, the research says 12 sessions once a week, 30 to 60 minutes, but I'm not sure if there's any indication of if it'll be successful within, like, for example, the first session, like if they do X, Y, and Z in the first session, will it be successful? And that has not been looked at yet.
Another interesting question. So at the very beginning of the webinar, you were talking about just the millions of homes in the United States that have animals in them, whether it's a dog, a cat, or something else. Did the research, was it able to tell at all how a child or a person with autism that was going to an animal assisted therapy, but already had an animal in the home, if that had any impact on success?
Yeah, so in most studies that ran like a complex statistical analysis, that was controlled for. So oftentimes that's a demographic covariate that is controlled for in the statistical models. Now, does every study do that? No, but many of them do. And that's something that as human-animal interaction researchers and people that study the animal-assisted interventions and service animals, we pretty much always, at least speaking for myself, control for the pet dog or pet cat in the house, just to make sure that we're seeing something different with the intervention that we're not seeing with a pet.
And I think this question might lend itself to a longer answer, but I think it's super interesting. What trends do you predict seeing in future studies? And are there any animals that you'd like to see added to these studies and to this research?
Yeah, so I think in terms of trends, I think a real focus from the research side is on methodology. So we really need to hone in on the rigor of these studies and make sure that we're spending time on studies that are giving us insightful data that can really inform things like policy and insurance and, practitioners who are doing this work and medical providers that are recommending this work. So I hope to see a trend in the rigor of research and having control groups and potentially doing some larger, like randomized clinical trials sort of situation. I think that perhaps the most common animal-assisted intervention for autism is therapeutic horseback riding or working with horses. So I anticipate seeing significant growth in that area to continue. I think the animal that is missing that I personally hope to look into is goats. So I think there's this idea of a care farm, which is essentially getting individuals back into nature. So spending time on a farm and just, participating in the farm life. And what we're seeing there is that obviously they're not just interacting with dogs. They're not just interacting with horses. They're interacting with all farm animals. And goats and pigs and chickens seem to have a special effect. And that is not at all research-based. That is my magic opinion there. But there's something magical happening between goats and humans and chickens and pigs. And there's no research on it yet. So I hope that someone will dig into that a little bit further kind of over the next 5 to 10 years so that we can really understand what's happening. I think the horse piece, horses are expensive, and providing equine assisted interventions is expensive, more expensive than a chicken or a dog or a goat or pig, for example. So if we could potentially, incorporate these other farm animals into these treatments, we could potentially create some access and break down some barriers there to provide these services for more individuals that truly need them. So I'll be interested. In the next 5 to 10 years, I think that definitely covers what I hope and think will happen, but who knows?
We actually had somebody in the chat while you were answering that says that their child works with chickens and hens and really likes it, and they help them a lot. So hopefully, hopefully there's more research on that later. I guess it's happening. So.
Those anecdotes, yeah. Again, the science is behind. The anecdotes are there, so that's awesome. Thanks for sharing that.
So then I guess probably have time for one more question. So typically when applying for funds or intervention, specifically in autism, parent or caregiver might need to provide peer-reviewed data that shows success. And so are there any specific studies within your, with the 2021 review that would perhaps help a parent support the needs? And that might be something that it might be a lot to verbalize, but even just a yes or no, I guess could be helpful at this point.
I would say yes, and potentially that review. So that review suggests that there are positive findings, some null findings, but no negative findings. So I think the majority of studies were positive in that review. So providing that would demonstrate that, or some of the articles within it. There are 43 articles within it. So I don't recall off the top of my head which ones were positive, but I would be happy to help you collate that information if needed.
Great. Thank you, Dr. Nieforth. And I think, you have you've been generous enough to put your email on the screen. So it sounds like some people might be following up with you, especially with that last answer. It sounds like you're open to that, and that's wonderful for all. So thank you so much for making yourself available and for being here today as our speaker.